8:35, and in today's Health Watch, Bristol Hospital is using a relatively new handheld diagnostic tool.
And it's making the lives of both doctors and patients a little bit easier. It's called the Mi Eye. Now, it can't replace an MRI in every situation, but when it can, it's cheaper, it's usually covered by insurance, and in some cases, it's much more accurate. Catherine Hinrichs is at Bristol Hospital to get her aching knee looked at.
It's like a hard pressure when I'm running, like every step that I take.
And the more quickly that problem can get diagnosed and fixed, the more quickly she can get back to being active.
I like to run and work out all the time, so I'm hoping that whatever the problem is can be solved.
Well, Catherine is in the right place. Dr. Chris Betz is using a Mi Eye to evaluate her. For people who have knee, shoulder, or hip pain, it's kind of like a portable MRI. And the device's makers said Bristol Hospital is the only hospital in the state using it.
Basically a 4K camera, inside this little needle.
The needle is 14 millimeters, or a little over a half-inch wide.
You put the camera in the knee, you pull this back, the camera deploys, all right? Yeah. And at that point you start actually looking inside the knee and you can give your diagnosis.
A real-time, full-color picture that the patient can see as well, if they're not squeamish.
They can download it on their phone, they can take the video with them, and they can actually see something happening.
But its biggest selling point for patients is its comfort and convenience.
It's a more comfortable setting for the patient. They're in the office, they can lay down, it's not going to go into a tube.
And boy, is it fast.
The Mi Eye takes somewhere between 5 to 10 minutes, where a normal eye takes about 35 to 45 minutes.
For Catherine, it took about 5 minutes to determine the problem was in her meniscus.
I think it's fantastic being this quick. This is great. I'll get to know everything.
And thanks to Mi Eye's minimal invasiveness.
All right, we're all done, guys. Okay. All right, so let's come out, Catherine. We're all set.
Catherine was up and on her way out in no time. Frayed meniscus, you were asking the problem was. So she had some meniscus problems in the past. You could see a little bit of the fraying. I forget what is going to happen if he has to go in there and repair it, but the idea was she got her answer quickly, very quickly.
Awesome. Having had 3 hip surgeries, those MRIs, boy, do they take a chunk of your day.
And then you have to go back.
Wait, it's a process. That's awesome.
Yeah, so
Very
when
cool.
possible, you get it all done at once. It's great.